There is a new movement and a concept in radiotherapy right now that is called UniteRT. If you have been at major conferences like Astro or Estro, or you have been on social media, you might have seen some people that have a UniteRT logo on their suits. I wanted to know what's the idea of UniteRT and what does it mean in the end for the cancer patients that we treat with radiotherapy. So let's jump into the interview.
Yeah, it's a group of companies or an initiative. It's a fairly loose organization, but it focuses around these three principles of open competition, open interfaces, and open communication. So that's kind of internal to the group, and it's a commitment between members to adhere to those principles. And the need comes from that we're all in the same fight against cancer. All vendors and all hospitals are, in a way, on the same side. Then again, there's also competition. And sometimes the way that competition is structured can be detrimental to innovation and to freedom of choice for clinics. So that's what UniteRT is angled around, to say that if all the industrial actors can maintain open interfaces, open competition, and open communication, then it can lower the barrier for new technologies to enter, because then they get access to these open interfaces and can connect themselves to other systems. So it can help drive innovation and ultimately then improve cancer treatments, because then clinics can pick and choose technologies more freely, and they're not bound to, because I chose this system over here, it's only compatible with A, B, and C over here, so then I can't choose the one that I really wanted that I think would be the best for my patients. So it's if more companies can join the group and live by this, then hopefully both innovation and quality of care can improve. But as you say, it's a young initiative. We just added our 25th member yesterday, and we have yet to kind of demonstrate what we within the group can achieve in terms of actual product interfaces because that's at the end of the day what the clinics will want to see, that so things that come from companies within the group actually start to work better together. But there's a lot of that development ongoing, but we don't have any proof points of new interfaces. There's a little bit, but that's going to come in the future. Yeah, it's that you have to imagine a situation where your main vendor has an offering of all the different components you need. You can get imaging and treatment equipment and software and QA systems and surface scanners, everything from one. And let's say that you actually see a clinical benefit that would benefit the patient from using, say, a surface scanner from another company or some motion management system. But you can't, because it doesn't connect to the stuff that you have. Then there is this lost opportunity of better care that you can't get to because of lack of interoperability. And I mean, in our example, it would be you wanting our splendid software and not being able to get it because it doesn't work with some of the equipment that you have. That's not a big problem for RayStation. It works with almost everything, but for RayCare, it's a bigger problem. And for lots of other members of the group that are in QA or imaging or surface scanning or immobilization, these things are issues, which is shown by the fact that in just a year to get 25 companies into the group, that's a fairly strong signal that it's not only us who believe that openness is a need. It's a bit explorative now. The Charter of Principles that is also published on the UniteRT website, it's not coincidentally, it was written from a software point of view. So it probably needs revision to handle situations where there's testing needs for hardware, where you need bunker time and all of that stuff has to cost money somehow. But the charter says that testing resources should be, I mean, if you and I test our respective products, I should pay for my time and resources and you for yours. But if you're providing a bunker, then it's that's not equitable. So it will need some adjustment. I think for the big players to be able to join. Of course, we have one very big player, which is GE, who was part of the initial members. But that's one challenge, and we try to be very clear about this, that being a member only means that you have to play by the rules within the group, but you can be just as open or closed or whatever you were in all of your relationships to non-members, so it doesn't change anything. And I hope that it's kind of looked at as an initiative to improve and ultimately have everybody join around these fairly simple principles. I mean, it shouldn't be so hard to say yes to. But again, they may need some adjustment, but then everybody should be able to get behind it. And I mean, RaySearch and me personally, I'm involved with it, but I mean, there's no power broking position. It's designed to be completely egalitarian between all members. So that's the idea.
All right, I hope that you learned something new about UniteRT and understand why it's important right now to have a similar concept in radiotherapy. I will personally be at ESTRO at Glasgow this year for the first time ever. So I hope to see some of you there and connect with some of you if you would like to meet or talk about some of your ideas. So thank you so much for watching, and I hope to see you in the next video. Bye.